I've had a lot of people diagnosed with pre-diabetes in the last 2 weeks, and they keep asking me, is it something that they should be concerned about? So I thought today I would go through what is pre-diabetes, what is HbA1c and the reference ranges that we should be looking out for, what causes pre-diabetes, are there any complications, and how can you counteract this? And I thought the best way to go through it would be to actually review the diabetes.co.uk website at the same time and just see what information they're putting out there. So we start off with pre-diabetes is a term that I don't tend to use that often apart from when doing these videos, because a lot of other healthcare professionals do brand this term around quite a lot. But the first thing is that it relates to a test called HbA1c. Now, HbA1c is a test that allows us to assess your blood sugars over the previous 3 to 4 months, which is a good idea of how your body is coping with insulin and sugar at the same time. And the way it does this is that it measures the amount of sugar that's attached to red blood cells. And because they live for on average 120 days, that allows us to look at that average over 3 to 4 months. Now, when it comes to results, this chart is actually used for treatment, but I can use it to explain what results mean. So 41 and below, ideally it should go all the way to 20, is what we would consider a normal range. And what you would find, a lot of the population is around 30 to 35, and the units are millimoles per mole. It's not relevant, but I just thought I'd go through it. And this range here from 42 up to 48, but not including, is known as the pre-diabetic range. And 48 and above is where we have diabetes. Now, when we're talking about pre-diabetes, it's pre-diabetes towards type 2 diabetes is the main thing, because type 1 diabetes is something that is genetic. It's something that you would normally acquire from a young age. And once you're diagnosed with type 1 diabetes, you are then prescribed insulin because your body has destroyed its pancreas that would normally have made insulin in them instances. So that's the conversion. I mean, a lot of people who watch from the US will use it in percent, and that is the conversion across. But in the UK, we use this bracket here where it's a higher number. So we want it to be less than 42, and 42 up to 48 is the pre-diabetic range. So now we know what a HbA1c test and that pre-diabetes is classed as that interim period. The diagnostic term is used because it is on the way to developing type 2 diabetes. Now, what it is actually shown is in a lot of these patients, there's normally a dysregulation, either a lack of insulin being produced or there's a lack of effect of insulin, known as insulin resistance, which is mainly the predominant cause of pre-diabetes. And in a lot of the patients that I review, it tends to be that they are overweight, inactive, or having a poor diet. So this is what we'll come on to later in terms of how we can counteract this going forward, because we'll find that a lot of the circumstances can be reversed or changed. So what causes pre-diabetes? So like I've just said then, insulin resistance is a common theme. When we think of diabetes, we tend to think of a disease or condition that's mainly related to sugar, which we assess it on sugar. And if you do eat large amounts of sugar during any phase and you are diabetic, it will worsen your blood tests. But in general, it's actually a disease of fat. And this is where insulin resistance comes from. So if we've got too much fat within the muscle cells, the liver, or the pancreas, the following can happen. So if we have too much fat in the muscle, then insulin cannot act on that cell. And that's a big cause for concern, because the muscle is a big place of where we store a lot of sugar in the body. And if insulin cannot work properly on the muscle cell, it means that we leave more sugar within the blood system. So that's one of the things. If we've got too much fat within the liver, it will put it out and it will go in towards the pancreas. Once the pancreas has too much fat within it, it changes the structure of the cells that normally produce insulin and thereby reduces the amount that it can produce. But in general, insulin resistance is driven by high amounts of fat. Now, how do we get a large amount of fat within the muscle cell, liver, or pancreas? And it's all down to quite a few things, and this is where I'll tie into how you can combat insulin resistance. So insulin resistance can signify metabolic dysfunction. And what that means is the body is not able to use energy sources effectively. So one of the things you might have heard of is aerobic activity. So zone 2 training, VO2 max training, that will improve the function of the mitochondria, which are known as the powerhouses of the cell. And if you can improve the mitochondrial function and later on density, meaning that there's more of them, then your body can utilize more fat, which then prevents any fat from building up within the muscle cell. So that's one way. Another way is that if you eat a large amount of saturated fat within the liver, it will convert it into particles that are then deposited within the liver, the pancreas, and in other cells of the body, because you've got excess energy which is then stored in fat. So thereby reducing the amount of saturated fat that you intake, or by increasing the amount of activity, which you've heard of the energy balance before, and I won't go into it fully, but if you have a higher energy input than output, then you will store energy, normally in the format of fat. So thereby reducing the amount of saturated fat and increasing the amount of aerobic activity will improve insulin sensitivity. But why is this all relevant? What is the scare factor and the complications of developing pre-diabetes or later on developing diabetes? Here is a list of things that can be precipitated or come about if you have type 2 diabetes or diabetes from type 1 or other avenues, but I'm focusing on type 2 diabetes because this is where pre-diabetes would eventually lead to. So you get a lot of eye problems, which I believe at the top of my head that 7 to 11% of all blindness within the UK is caused by diabetic patients. So that is, the fancy word is called retinopathy. You can get heart attacks, strokes, and a few other cardiovascular diseases because the diabetes, in my opinion, is one of the most multimodal diseases. It affects many organ systems, and it's why I believe we should be trying to improve insulin sensitivity and reduce your HbA1c to lower levels to prevent all these. Some people may be aware of kidney damage, so the fancy terminology is nephropathy. And then because of the amount of sugar within the nerves, etc., you can get nerve damage, which is diabetic neuropathy. There are many other problems, so sexual problems can come about, again, due to cardiovascular disease, poor circulation. And that's another issue, is that a lot of diabetics have poor circulation, hence you have to go and get your feet checked. But these are all things that we look out for on a greater scale nowadays, but there is still a reduced life expectancy, which I'm trying to actually find. The idea of doing this video whilst looking at Diabetes UK was to actually use the website, but at the same time I'm mainly doing it from what I'd like to discuss. So I'm just going to have a quick look about life expectancy, but on average it's 10 years less than someone without diabetes, which is still quite a significant amount despite the amount of modern day treatment that we've got. But when I look at diabetes and pre-diabetes within the community, within GP surgeries, we are quick to give treatment once you are classed as diabetic, but ironically, when you're pre-diabetic, we don't really intervene. It's not on our radar. We may repeat a test in 12 months. My practice is slightly different. As soon as I see someone who's pre-diabetic, I will go through what I'm going through now in terms of lifestyle adaptations that you can make. And that is something that I would like anyone to take out of this video, is that if you've got a non-genetic form of diabetes or a non-autoimmune form, such as type 1 diabetes, then it is reversible. And it's mainly due to a lack of activity or poor diet. They are the two fundamental factors within developing pre-diabetes and type 2 diabetes. I see it every single day. I've had a couple of patients today who are in excess of 120 kilos. There's no coincidence. But this was a whistle-stop tour on pre-diabetes, HbA1c, a bit about type 2 diabetes, largely affected by lifestyle. And it is, in my opinion, a disease of accumulation of fat within certain tissues in the body, which then manifests in terms of high blood sugar because we can't get it into the cell due to insulin resistance. So work on them factors. By all means, if you need to go on medication, I am not naive to that fact. There's a lot of patients who benefit from it, and I think we need to use them in conjunction, but I don't think it should be the primary and first line. We should be looking at alternative methods, because if you look at type 2 diabetes, it's only been prevalent within the last century, and it's normally because it's a disease of abundance. Type 1 diabetes has been around since the Greek times, I believe the Egyptians, because that's where the terminology comes from. But type 2 and pre-diabetes is due to overindulgence, and it's something that the modern era needs to reverse, and that's the way we can go about doing it. So thanks for watching, and I'll see you next time.